I see a lot of patients with carpal tunnel. It's one of those things that is really just so common. Of course, as a hand surgeon, I would see that, but even my general orthopedic colleagues see element of carpal tunnel syndrome. And of course, just to define that, that's when the median nerve or the nerve in the hand is being pinched, and it's basically in the hand and wrist area. It causes numbness and tingling in your fingers, particularly the thumb, index, and middle fingers. So one of the things that I see is very often patients first want to treat themselves. I mean, the first thing they do, if it's bothering them at night, they shake their hand away, they try to a different position while sleeping. But there's some things you can do that if the carpal tunnel is mild enough, you may not have to come in to see us, and you may actually even avoid surgery if you catch it early enough. One of the things that can be done more on the more natural end would be supplementing with B complex vitamins. That can be something that can help for very mild cases. And that can be over the counter in the health food store or in the in the drugstore, CVS, Walmart type situation. The other thing is it's very easy to get a carpal tunnel splint on Amazon. Now, there are different variations, but essentially it's the same thing. It's wrist support. It prevents you from bending your wrists in all kinds of crazy positions when you're sleeping, because in many cases, that's when it bothers patients the most. They can't rest and they can't sleep. One of the things that I tell patients is that in general, medications, say, for example, pain medications don't generally help. I mean, there are nerve medications, but I don't prescribe medications for carpal tunnel. But occasionally some patients have said that taking things like Motrin helps. But I think between the B-complex supplementation as well as the night splinting, those are probably the two main things that you can do. As far as other things, I mean, you may have, different risk factors. And then also notice, particularly in your work, if there's something in particular or a particular activity which causes it to happen. Some people, it happens a lot while driving. So, if you're driving a lot and your hands are going to sleep, wearing the carpal tunnel splint during those activities would be helpful. So there are a few things that you can do before we actually see you in the office. And of course, in general, it has to generally be on the milder side for these things to help. When these things aren't helping, then that's the time you come in. And usually we start with an injection and maybe a splint, or we may move to nerve conduction testing to see if there's a pinch, if the nerve's being pinched any place. And more recently, I've started looking at the nerve with the ultrasound, because you can actually diagnose carpal tunnel very well with an ultrasound just by measuring the cross-sectional area. So that's something that saved a lot of time and some discomfort as well with getting nerve testing. So those are some of the things you can do to treat yourself when you have these symptoms coming on and you're not wanting to come in to see us, or you just don't have time, or, scheduling is difficult. So try these things first.